My name is Sergio Nabais de Araujo, but I'm usually known as Sergio Nabais. That's my clinical name. I am a consultant cardiologist at Salisbury NHS Foundation Trust since 2014. I think I decided to become a doctor during secondary school and my teenage years. I come from a family of doctors on my father's side. My grandfather was a mouth disease specialist doctor, and my father was a GP. So I was exposed to medicine and medical talks from a young age. I also found myself as having a scientific driven mind during school years. I was a good student, so getting into medical school felt like an amazing opportunity then. Interestingly, I think it was only during my medical school years that I eventually realized, the true value of being a doctor and helping someone in need of advice or treatment, and the personal reward associated with that role. Well, I think there were two main aspects that led me into cardiology. The first one was that during medical school, a couple of professors made cardiology appear as the pinnacle of medical specialties. One of them had amazing clinical skills and made cardiac examination and cardiac auscultation so captivating, and offering the key to diagnosing a patient's condition using only your senses. Um, and another professor offered a systematic approach to electrocardiogram or ECG reading. And so being able to read an ECG felt like a massive overnight leap in my clinical skills, and that was quite exciting then. The second reason I think led me to cardiology was that unfortunately my mother passed away suddenly at a young age when I was studying for my final first year exams at medical school. She had a pulmonary embolism or blood clots in the lungs, and I think I promised myself then I will never miss the diagnosis of such a critical cardiac condition. I think the most rewarding aspect is when patients say they feel much better after starting treatment or after an intervention. That certainly bright any less good day. And also in the more acute setting, it is also very rewarding to provide life-saving treatment and see patients carry on with their lives after a major cardiac event. And that's the case, for example, with stent treatment in the setting of a heart attack, or urgent treatment in patients with heart failure. I believe my patients value mainly my listening skills, my full dedication to their problems, and offering them all the tools available to improve their condition. Personally, I certainly value the trust my patients put in myself and my treatment plans, their patience to listen to my explanations about their condition, and to the possible management plan options we may have. So I do not think I have any catchphrases, but many times I say that we should listen carefully to our patients, as the diagnosis will often be in their words. And I also like to think that we should always learn and grow from our interaction with a patient, and we should always stop and reflect when the patient's problems do not fit neatly into a diagnosis that may have been made previously.